Okay, let's just dive right into this explainer. When you think of mint, you probably think of gum, right? Or toothpaste, or maybe a nice, soothing cup of tea. But today, we're looking at the hard science. We're going to see how peppermint is so much more than just a candy flavoring. We're talking about the clinical, evidence-based reality of a plant that is actively used right now in modern gastroenterology, neurology, and respiratory care.
So, we really need to dismantle this idea that peppermint is just some old traditional folk remedy. We're looking at the hard clinical evidence here. Because the truth is, the extracts from this plant, specifically Mentha piperita, contain highly stable, pharmacologically active compounds. I mean, they've been the subject of literally over 1,000 medical papers. This isn't just about feeling refreshed. It's about actively altering cellular pathways and muscle contractions inside the human body. Here is our roadmap for today. First, beyond the dinner mint. Then, calming the gut, IBS. 3, soothing tension headaches. 4, respiratory relief and nausea. And finally, number 5, how to use it safely. Section 1, beyond the dinner mint, microscopic power. First things first, we have to look under the microscope to see what makes this plant so incredibly powerful. Peppermint essential oil is a highly complex, volatile mixture. It's made up of over 100 different compounds, but there's one absolute star of the show that drives the vast majority of its medical efficacy. And that star is L-menthol. The crucial takeaway here is that L-menthol is the primary pharmacological driver responsible for peppermint's biggest medical benefits. It makes up anywhere from 30 to nearly 50% of the essential oil itself. L-menthol actually has a highly stable electronic configuration. It acts as a direct competitive blocker of calcium channels in your muscles, and it uniquely interacts with the temperature receptors in your nervous system. These incredibly potent properties explain exactly why peppermint has those thousands of medical papers researching its effects on us. It is absolutely not a one-trick pony. The L-menthol, working alongside other compounds like menthone and rosmarinic acid, combine to do some pretty amazing things. They relax smooth muscle, reduce inflammatory markers like interleukins, kill off harmful bacteria, and even relieve trapped gas. It's really doing the whole shebang. Section 2, calming the gut, treating IBS. Now, let's move down to the digestive system, which honestly is truly the holy grail of clinical peppermint research. For decades now, gastroenterologists have been using peppermint oil to treat functional bowel disorders, with the most notable one being irritable bowel syndrome, or IBS. Get this. In one major double-blind study, patients dealing with irritable bowel syndrome experienced a massive 40% reduction in their total symptom scores after using targeted peppermint oil for just 4 weeks. I mean, compare that 40% to only a 24% reduction in the placebo group. That's huge. And multiple meta-analyses looking at thousands of patients have confirmed it. Peppermint oil is statistically superior to a placebo when it comes to relieving overall IBS symptoms and severe abdominal pain. But how exactly is it pulling this off? Well, the mechanics behind this relief are just fascinating. You can think of L-menthol as this microscopic bouncer. It stands at the door and blocks calcium from entering your gut's muscle cells. And without that influx of calcium, the muscles simply cannot contract violently. It effectively shuts down the chaotic party of intestinal spasms. Plus, at the exact same time, it blocks specific serotonin receptors to reduce nausea. And it even lowers the resting tone of your esophageal sphincter, so any trapped gas can easily escape. Because of all this, major health agencies, like the European Medicines Agency, actually classify the oral use of peppermint oil for severe gastrointestinal spasms as a well-established medical use. This isn't just traditional folklore anymore. The clinical data gives us absolute scientific evidence of its effectiveness and its safety for relieving belly pain and spasms when it's used correctly. Section 3, soothing tension headaches. Neurosensory science. Okay, let's travel from the gut all the way up to the nervous system to see how peppermint tackles head pain. It turns out rubbing a little peppermint oil on your temples for a headache is entirely backed by modern neurosensory science. Who knew, right? So, your skin has this receptor. It's called TRPM8, and it acts almost exactly like a biological thermostat. Normally, this receptor just sits there quietly until the temperature drops to somewhere between 15 and 28 degrees Celsius. At that point, it fires off a signal straight to your brain saying, "Hey, it's cold out here." Well, menthol happens to be the ultimate chemical hacker for this specific receptor. Len-menthol literally tricks this receptor into feeling cold. It actually drops the skin's temperature by 2 to 4 degrees Celsius. And that effectively blocks tension headache pain signals. This process is known as the gate control theory of pain. Basically, that intense, localized cooling sensation races up your sensory nerves, and it essentially closes the gate in your central nervous system to those slower-moving, throbbing pain signals of a headache. It's like a traffic jam where the cold signals get to pass fast, but the pain signals are stuck. Section 4. Respiratory relief and nausea, chest and stomach. Moving into the chest and stomach areas, peppermint offers us both traditional and highly modernized relief. Honestly, if you've ever used a medicated chest rub when you've had a cold, you have already experienced this firsthand. While peppermint definitely has a long proven history of clearing out congestion, recent clinical data shows that aromatherapy with peppermint oil is also highly successful in stopping chemotherapy-induced nausea. On the respiratory side of things, breathing in menthol acts as a fantastic expectorant. It breaks down the mucus in your lungs so you can actually cough it out. But on the anti-nausea side, inhalation of peppermint essential oil has been proven to significantly settle the stomach. This offers a really safe, non-invasive adjunct therapy for patients who are going through intense treatments like chemotherapy. Section 5. How to use it safely. Crucial guidelines. Now, because peppermint oil is so highly pharmacologically active, there's a pretty crucial catch regarding how you actually administer it. Getting it into the right part of your body without causing any collateral damage requires some very specific engineering. This is where it gets absolutely critical. If peppermint oil releases in your stomach, it causes severe heartburn. Therefore, taking it in an enteric-coated capsule, so it only opens up once it reaches your intestines, is absolutely vital. Remember how we said earlier that it relaxes smooth muscle? Well, if raw peppermint oil hits your stomach, it relaxes the esophageal sphincter, which basically allows stomach acid to shoot straight up into your throat. Ouch. So, enteric-coated capsules are designed with these acid-resistant polymers. They survive that harsh acidic stomach environment and only dissolve once they hit the neutral pH of your intestines, which is exactly where those spasms are happening anyway. But here's where you have to pay very close attention. You must never, ever mix these capsules with acid-lowering medications. Why? Because those meds alter your stomach's pH and they'll dissolve that protective capsule coating way too early. Think about it. If you take a proton pump inhibitor or an antacid, your stomach becomes less acidic. The peppermint capsule gets confused, it thinks it's already reached the intestines, and bam! It bursts open right in your stomach. To avoid this whole mess, you just have to carefully space out when you take these medications. This also brings us to a particularly urgent safety warning, especially for parents. Because it is such a potent bioactive compound, peppermint oil must be kept far away from the faces of infants to prevent dangerous breathing issues. The powerful cooling sensation and the muscle-altering properties of menthol can actually cause sudden bronchospasms, tongue spasms, and even respiratory arrest in babies and very young children. So it is strictly for adult and older children's use when you're applying it topically or inhaling it. But overall, the science is incredibly clear here. When it's used correctly, peppermint is a highly structured, evidence-based medical tool. It is not just some alternative therapy you read about on a blog. It's a validated intervention that operates on defined cellular pathways to relax your muscles, block pain, and clear up congestion. It really represents this fascinating bridge between traditional botany and modern clinical pharmacology. So the next time you feel a tension headache coming on or you're dealing with an IBS flare-up, will you look to the mint plant for a scientifically proven solution? Now that you know exactly how the TRPM8 receptors and the calcium channels in your body respond to L-menthol, you've got a seriously powerful, evidence-based tool at your disposal. Thank you so much for joining me on this explainer, and as always, stay curious.